I'm Henry.
Hi everybody, my name is Maureen. Henry, who have we got today?
We have Vernon Bainton on our podcast today. He's Chief Medical Officer at the Havas Links. He also has a health and happiness lab.
Oh, that's interesting.
Very good. Yes.
Looking forward to hear about that happiness lab.
Indeedy. So, what have you created joy outside of work?
Well, I'm mainly a joy outside of work, and I have just come back from Morocco.
Oh, really?
Yes, just come back from Morocco. I'm not going to tell you about the dramas, Henry. That's going to be something else. But the joy was my first time of taking a ride on a camel.
Oh, seriously?
Yeah. Oh, they were so delightful. I mean, some of them were grumbling. I don't blame them carrying people around when they could just be grazing all day. But it was joyful. The people were lovely, and it's somewhere that I'd always go back to as well. Yes. So what's been giving you joy, Henry?
Well, I have a case study. So I talked about Gurpreet in Hounslow. Do you feel more confident in enabling others to make decisions? Yes, 100%. And she's talking about what her values are, the values of Hounslow. Do new lead with heart, pass on the power, and they're all like the happy apprenticeships.
Oh, great. And what level?
Level 5.
Level 5.
Yeah.
So it's funny because some people feel that the level 7 is where the biggest impact is, but it is through the 3 and 5. The 5 really make a difference because they're really at the heart with their people. That's lovely to hear.
Absolutely. Okay. So, Vernon is a trained doctor who now works at the intersection of medicine, creativity and communication as Chief Medical Officer at Havas Links. But what I want to explore is that Health and Happiness Lab, an initiative that asks the deceptively simple question, what actually matters to people living with illness? The lab looks beyond traditional clinical metrics to focus on subjective well-being, quality of life and happiness, especially for people with long-term conditions. It challenges the idea that health is only about fixing what's broken and instead asks how healthcare questions can support dignity, agency and meaning. Vernon Bainton, this feels like a different lens on healthcare, less about treatment alone and more about lived experience. I'd love to explore where this work came from and what it's trying to change.
Fantastic. Well, firstly, Henry, what an absolute delight and a pleasure to join you on the podcast. We've a lot of ground to cover.
Yeah.
If you looked at the news on any given day, you wouldn't believe how fundamentally important happiness is to human beings. And actually, in broader terms, well-being. So we're seeing a really interesting, exciting time where we're starting to understand humans in a bit more complexity, and not just around diseases and illness, but in terms of helping us to thrive and flourish in a more broader context. And health is central to that, and our own well-being and happiness is very important for us to understand. So it came about by a whole variety of happy serendipitous occurrences that I can talk to you and your listeners a little bit about, where we've got to, if you like.
Okay. So you trained and worked as a doctor before moving into healthcare communications. What problem were you trying to solve that clinical practice alone couldn't?
So I fell into medicine. It wasn't a calling, right? I found my calling later in life. I studied sciences and maths, but truth be told, when I was just a nipper, a lot younger than I am now, I wanted to be an artist. Being an artist wasn't a proper job. And I was very nerdy and I was very academic, and I did sciences and I did maths. And at the time, the career advice I got was, are you going to be a doctor or a lawyer? Because I did well at school. Well, obviously, medicine was the closest to science. So I ended up going and studying medicine. I studied medicine, did a degree in pharmacology, qualified in medicine, worked as a physician, and then swapped into anesthetics and was training as an anaesthetist. For a whole variety of reasons, personal, professional, health, life circumstances, it wasn't for me. So I transitioned into the pharmaceutical industry, and I transitioned into pharma, where we were launching medicines in mental health and in oncology. And I was working in medical affairs and then commercial roles. And I came rapidly to the conclusion that whether it's a drug, a medicine, whether it's a treatment, whether it's a care pathway, whether it's a software for medical service, or whether it's a human intervention, if I can't persuade somebody to prescribe it, somebody to pay for it, and a patient to use it, it was all for nothing. And I fundamentally realized communications were utterly critical. And actually, that was what I really loved doing. So then I moved into the world of agencies for marketing, medical education, patient empowerment and activation. And I've been part of the health tech and innovation scene for a long time as well. And I love it because it's the intersection. Communications is the grit in the wheel, and it's the fulcrum around which science and medicine and healthcare and policy and health tech all intersect, where we can make massive change, societal change, healthcare change, and make a difference to people's lives. So that's how I ended up in the communication world.
Okay.
And along that journey, I met an individual through the health tech space who's the co-founder of the Health and Happiness Lab. So she's my co-founder, Catalina Cernica. And I met her in health tech. And originally, the lab was born in Denmark.
Yeah.
And it was the Health and Happiness Foundation. And it was born out of Leo Pharma Innovation Lab. The simple question is there a better way to measure subjective well-being in people with chronic disease? And are there better tools to measure well-being for people with long-term illness? And how can they help the health system and the patients to thrive better and have better outcomes? That was the germination, as it were, and the foundation originally. And then we incorporated it as a community interest company here in the UK as a lab, the Health and Happiness Lab. So myself and Catalina set that up over here.
So, Maureen, you're here.
I am.
Hello, Maureen.
Hello, Vernon. And I hope I didn't interrupt you. That sounded so interesting.
I was on a roll, but it was my backstory. I'll talk about that for ages. So we'll get to the good stuff in a minute, I promise.
So now the Health and Happiness Lab is a community interest company. So it is set up for public purpose rather than for profit. Tell us why you did this.
We did it for a couple of reasons. We did it because for different funding streams. So if you're set up as a charity, obviously you can get funding for various things, but you're a charitable organization. If you're purely commercial, you're always feeding the beast to make money, right? Money makes the world go round. We actually thought is a really interesting opportunity somewhere between the two as a hybrid that allows us to have different funding models, but also allows us to put the money back in as a research. It's an independent research machine, effectively, to look at new tools and approaches to help us measure human thriving and flourishing and happiness. Because I'm old enough, you and I, Henry, Maureen, you're not old enough for this, but happiness and well-being was always regarded as a bit dippy-hippie, right? And a bit, lovely, subjective. Not hardcore medicine, not where I used to work, which was in critical care and with sick people in hospital. And actually, things have evolved and moved on significantly from that. And we've now much better ways of starting to explore, dimensionalize and measure and think about what it is to be well and thrive. And that isn't necessarily the absence of health and disease-centered components. And it's thinking about people aren't patients, they're people.
Yes.
They just happen to have an illness and it infects and impacts their life. So let's think about them in a broader sense.
So can you just tell us a little bit more as well? I mean, it's really interesting to hear that this is something that's more like charitable and around happiness. But personally for you, what made this feel really necessary?
I thought it was a massive opportunity to be helping health systems, the pharma industry, to head towards a patient and person-centered approach to healthcare. So let's be honest, we've talked about patient-centered care for 20 years. We haven't done a lot about it really, or it's been in fits and starts and silos. So I saw an opportunity that actually helps different purposes, but is a really good way of taking scientific rigor and some methodology to actually objectively measure some of these metrics, right? So that we can show objectively what matters most to patients, and then how best can the health system and treatments and care provide that so that we can level the playing field a little bit. What people want with an illness is day-to-day functioning, right?
Yeah.
They want to work. They want to get on with their lives, have relationships. Some people want to have kids. They want to get on with things. The health system has been designed and set up with a disease-centric model, which is all about looking at disease and signs and symptoms of disease and clinical metrics and removing them, right? And that's very important. The challenge comes between the discrepancy of expectation or the want or the need or the requirement. And if those things don't align, there's a mismatch between what patients want and need and what the health system can actually provide and is able to provide. And that's where I saw the gap. And I see the sorts of tools and the methodology that we apply through the lab to help reduce that gap, really.
I love that. I've never ever actually I've really heard that in the way that you said, in the sense of like, what does the patient want? What do people want?
Healthcare is there to provide, it's a service for the people, right? It's not in and of itself for the healthcare, it's for society and for the public good. But helping patients articulate what matters most to them and helping the health system to understand that allows us to come together in the middle. And you get better outcomes. We know that clinically, qualitatively and quantitatively. And we'll perhaps come on to some of those in a sec.
How is happiness different from well-being, quality of life, or patient satisfaction, or is it not?
Oh, no, that's a killer question, right? And how long have you got? No, these terms tend to get used really loosely and interchangeably. And actually, they are quite different and they were born of different environments and they do different things. So I'm going to try and make it really simple.
Yep.
Okay.
Make it simple and then we can get into the complex. So happiness generally is all about this sense of mood. And what is your affect, your mood, and how is it presenting in you? So it's much more a psychological state of being. And it's got its own terminology and its own definition and its own language, right? Well-being and wellness, but if we go with well-being, is a much broader concept that includes a whole raft of different things. So the World Health Organization defines, this state of sort of complete physical, mental, social, emotional, spiritual, financial well-being, or a state of, a positive state and an absence of disease, emphasizing these sorts of aspects around health, happiness, prosperity, social inclusion, all of these much broader constructs, right? And it was born much more of the psychology and sociology world from a research perspective. Then we start getting into notions of quality of life. And in healthcare terms, this is very much around measuring how a certain ailment impacts an individual and impacts certain dimensions of their life. And that's a way that has been taken up very much in the healthcare setting of trying to standardize and normalize what treatments do in terms of quality adjusted life years. And that's great, but it's slightly biased, right? And it's a slightly blunt tool. It underestimates the impact of emotional, psychological, mental health issues. Bit gender biased and other aspects. And in certain conditions, it tends to skew some of the results. So it's not a real broad metric. It doesn't include the patient experience properly. It doesn't understand the impact of the individual, of the disease and the treatment, and take that all into consideration. So now there's more progressive, more contemporary approaches to think about these things. We talk about now patient experience and patient satisfaction. And what's really interesting to see is that just before Christmas, the European Medicines Agency, EMA, have opened a consultation with industry and with the clinical community to explore how they should be measuring patient experience in terms of real-world evidence and capturing what it's like to not just live with the disease, but also live with the treatments of the disease. So in blunt terms, if a treatment is really effective in treating you, but is horrible to take and is very, very impactful on your life, you have to take that into consideration.
Yes, okay.
So you can't be myopic. You have to take a broader approach. So there's a consultation that's happening at the moment with Europe, as I say. But these are they allow us to be really at the forefront of changing the narrative, the definitions, the way we think about it. And also technology is starting to play a role, right? So we can be wearing wearables or digital health, or there are a lot of new solutions that help us to capture lots of aspects of day-to-day living that otherwise didn't exist. You saw a patient every 3 months in a clinic, right? In an outpatient's clinic. And you had to hope that the patient told you what it had been like for the last 3 months. And of course, what did they do is they told you what it was like for the last week or when things were really terrible, because that's the way our memory works. So there's now better ways of measuring what it's like to live with the condition. And so we should be taking that into consideration in terms of treatments and managements, right? And let's be honest, the population's aging. We're gaining complex comorbid conditions. We need to be empowered and activated to live well out in the real world, in our communities, with our communities, and try and avoid expensive, potentially unpleasant hospital settings, right? Where things might go well or not go well, or they're expensive, they're costly, they're not sustainable. We need to keep people weller, and especially moving away from just a treating reactive sick people into a preventative model. And that's about empowering people to all of the behaviors and in trying to incentivize prevention and well-being. And again, these tools that we're looking at are better ways for people to consider what matters to them and how it affects their health. And so they can actually be informed to make activated and empowered decisions. So there's lots of different terms. So happiness is all about mood. Well-being is a much broader concept that's got multiple different domains in it that we have to try and think about and dimensionalize. The standard approach, the traditional approaches in healthcare have all been around disease-centric models. And now we're thinking about much more of a person-centered and society-centered model for what wellness and happiness in its broadest sense is.
Now, you talked about in your email that when we did COVID, we did exactly that.
Yeah. So we started the lab to look at people with chronic illnesses. So people with chronic inflammatory diseases. What's it like to live with the disease over time? Now, that methodology can be used in different settings. And actually, what we found is you can look at it for people who don't have illnesses, or whether they do or they don't have illnesses. So I don't know how much you guys probably do with your work. You probably know a lot about staff satisfaction surveys.
Yes, we do.
So Gallup and a few other companies for many, many years basically said, how satisfied are you with your job? Is your manager a bit of a prat? Do you get paid well? And can you get promoted? And if you look at then business metrics, is it successful? Then that was a good enough surrogate, staff satisfaction. What we learned just before COVID was people are much more complex than just a sort of very dull, simple approach to staff satisfaction. Your mental health, your mood, your relationships with your team, your autonomy, mastery and competence, your sense of control and your sense of self was a black box. And it was always regarded by HR like, don't talk about those things because they're too complicated. What COVID did is we all went remote. So all of our staff are at home. And for people like me, older, more senior, had an office space at home. Oh, it was fantastic. I rolled out of bed and plugged in and I was at work and I was competent and I knew what I was doing, right? It was great. All of our junior staff, our younger members of staff, we invaded their personal space, right? We expected them to learn, and ours is a craft, ours is an environment of apprenticeship, right? Learn with remote learning without any of the apprenticeship and coaching and support on their own in an environment where they didn't have the tools whilst we were dealing with COVID, right? And we realized very quickly that suddenly that staff satisfaction and business performance were decoupled. And the contract with which you go to work and go to an office and then do your 9 to 5 and come back just basically didn't exist anymore, right? So what we did as a business is we felt it really important for us to get a handle on how our staff were. How were they managing with that situation? And what were we going to do about it? Hope is not a strategy. You need to understand and make a plan, right? So what did we do is we took the methodology where we look at life evaluation, affect, mood, relationships, and this sense eudaimonia, which you'll know what it means, but it's a big word that basically means meaning, purpose. The Japanese have got a lovely term around ikigai around this, right? But about this sense of purpose and meaning. So we use the OECD model around happiness. So these are well-validated tools. They took the Bhutan model of societal happiness, if you're familiar with that, and then started applying it to other countries. So we took their model and we used it to build our surveys for our staff. And we started exploring how did they feel about themselves, their work, their colleagues. And we asked a lot of questions that they hadn't been asked before. There was a challenge from the business to be asking these sorts of very personal questions, right? But what it did is it shone a light on this black box of topics that we never really dealt with, never needed to. Trust, collegial bonds, respect, autonomy, mastery, as well as the usual competence, satisfaction, promotion, upward mobility, pay, and all of those sort of standard things. So it gave us a much better 360 view of what was impacting our staff and how were they interdependent. And you know what we discovered?
Go on.
We discovered loneliness was the biggest challenge that we had to deal with, right? And it sounds obvious when people are at home on their own, right? Yeah. And notwithstanding, there's lots of advantages to working hybrid and not having a commute and the pay and all of that stuff, right? But there's a real sense of loneliness in that setting, right? So we had to deal with the loneliness that went with people working remotely and not connected, not feeling they belonged. And then it also allowed us to look at lots of other sort of topics and really make it actionable all around. If I just trust the quality of their relationships, recognition for what they do, their work-life balance, something's got to give. This notion that you can have your work and your life and split them 50-50, but yet work at 150% capacity, and there's only 169 hours in the week, right? It's just nonsense. You've got to get a balance between people's work life and home life, right? And so it gave us a much richer understanding of how well-being affects your sense of self and how your sense of self affects your ability to do your job. Because going back to the point I made earlier about well-being and subjective wellness and happiness being a bit soft, men. Yeah, no, they're not. No, they're not, right? So people that are happier are more productive. They stay twice as long in their jobs. They spend more time at work focused on their core responsibilities. They take less sick leave. They have less presenteeism and less absenteeism. They solve problems faster. They adapt to challenges faster. Everything in modern life is about adapting to change, right? They receive feedback better and don't take it so personally, and they get promoted quicker. So the business makes more money, they make more money.
Absolutely.
And they feel better about themselves.
It makes sense, right?
It's not soft. This is not soft metrics. These are hard business facts.
You have all this proof, you have all this evidence. What changed?
What changed? There was a sea change in the acceptance from both individuals but from the organization that we have to do something about this. It's not just an obligation. It was a business necessity. It's a value and it's a differentiator for us in terms of retention, recruitment of best staff, in terms of the quality of our outputs. Look, we're a human capital business. Our business is based on brilliant people, right? Notwithstanding the application of AI and all the rest of it is changing how we do our work, but it is still a business of people coming up with ideas, right? And so the better we can make them feel about themselves and the more autonomous and competent and the more positive they can feel as a result of the work that they do, the better work they deliver, right?
Yeah.
So how could ideas from the Health and Happiness Lab realistically fit into the NHS today?
They can fit in on two ways. One, where it started, which was about better understanding of patients, right? When you look at population health, medicines on a societal level and population health, medicines, do you know how much health outcome out of 100%, out of a whole society, how much benefit comes from medicines alone? Medicines and hospital and clinical care.
Don't know.
I bet it's not that high. Oh my gosh, it's a trick question. Do I get a prize? No.
It is a trick question. It's a terrifyingly small amount.
I can imagine.
Terrifyingly small amount. Depending on how you measure it, it's down around the 6 to 10% mark.
Wow.
Because behaviors, genetics, where you were born, right, where you live and your community environment have much bigger, on a societal population level, have a much bigger effect on your health than treating a condition with medicines. But those are much bigger social challenges for us to deal with. So from an NHS perspective or from a healthcare perspective, better measuring and understanding how to help diminish the impact of disease and diminish the impact of treatment and care is cost effective to the health system, right? Ultimately, it will be if the outcomes play out. But the other side is the workforce. So the NHS is what? The fifth largest employer of people on the planet, right? As an organization, 1.4 million people. We are living through the highest rates of burnout in healthcare staff. Do you know where the term burnout came from?
Go on.
No. Tell me.
The term was coined in the 70s by an experiment that was done on healthcare professionals in a caring setting where they were overworked. there was a discrepancy between the care they wanted to provide and the care they were able to provide in terms of resource, right? So they were in a resource-constrained environment and it was very difficult. And they were suffering moral injury and emotional distress because of the discrepancy. And so it was framed around this burnout. They weren't able to deliver the care that they needed to give. And so 50 years later, we're in a situation for a host of reasons. Decades of underfunding, complex care, expectations going through the roof from patients, the challenges of the infrastructure. There's a whole host of reasons why. But the staff that are left are suffering as a consequence, right? And so there's a very high level. So it's a grim stat, but healthcare professionals are 6 times more likely to kill themselves than members of the general public.
Wow.
Yeah, there are certain professions that have very high rates of suicide, and HCPs are one of them. Now, from a workforce and a workforce planning perspective, there's lessons to be learned here. So telling people who are really, really over-resourced and working in a very stressful environment with other people's help to do a resilience webinar in their spare time, maybe not most effective outcome.
No.
Right?
No.
And I'm not joking. So there's lessons to be learned, not just in the NHS, but internationally, for what it is to be a healthcare provider in this day and age, with the complexity, keeping up to date, the difficulties with all of that innovation, with rising expectations from patients, the need, the mix of private and public healthcare. Medicine is changing and healthcare is changing rapidly. And I think we owe it to society. There is no economy. That's another thing that COVID taught us, right? There is no economy without a healthy population, right? And so we need to think about it just from a population level, from a healthcare provider and a health systems level, right? And what are better ways of thinking about this long term for sustainability?
Yes, definitely. And I suppose around my question about what's changed, I suppose it's like, what gives you hope and what you're looking at the future in terms of the well-being in healthcare?
I think it's a very exciting and interesting time, and it's a very dynamic time. I think there's a lot of people that are doing really exciting and interesting things, but it's not without many, many challenges. We have to be careful of making sure it's evidence-based. You know, we live in a world now with influencers, with the well-being market, with certain political narratives that are anti-science and anti-evidence-based healthcare, and financial incentives in a well-being that are of no use to anybody and certainly not going to make anybody better. So we have to be very careful about the language. We have to be careful about the evidence base. But if we apply things that are credible and sound and evidenced, there's massive opportunity for change, particularly with the application of technology. And there's loads of reasons to be very positive and excited about how things are going to pan out in the next 5 or 10 years.
And could AI work with doctors or something like that?
Yeah, absolutely. So we've lived through the internet way back when there was the photography, changed the world of art. Before that was a printing press. So it is a modern, massive transformation in the way in which we're going to be working and what we're going to be doing. And it's transformative technology. That health tech and innovation space is very exciting to see it being applied both for healthcare stewardship, optimization, care and management, and real, as a medical device. But it's a technology, so it can also help patients navigate and support them out in the real world, where they spend 99.9% of their time away from the health system.
Yes.
The challenge is technology can be used good or bad, right?
Yeah.
It's how we use it that matters.
Exactly.
Right. So, 3 tips for a happy workplace.
3 tips. I think moving from this sort of employee engagement, job satisfaction, old world, traditional, to one that's more around happiness and well-being. Think about people having a life as a whole and the role that having a job plays in that, because they affect each other. They impact each other. So change the way you start capturing information as a workplace. Think about satisfaction. What makes people feel satisfied with their work and with their job? And think about long-term goals around culture, structures, and policies that are going to actually help you change it. And it moves towards a sort of attitudinal and perceptual change in the way in which you're talking about it. And it's really empowering to get into that space, right? And it allows people to have grown-up conversation. It's about nurturing, it's about coaching, and it's about supporting each other, right? Trust is one of the most fundamental things in colleagues. If you want to have a high-performing team, look at trust. So look at the way in which people are treating each other.
Absolutely.
And the way in which they feel trusted. And that doesn't mean to say you give everybody a pass when it goes wrong. Somebody's got to be accountable.
Yeah.
It doesn't mean to say you're going to be all soft. It means you can make some hard decisions, but everybody understands why and how and their part in it. And load them up with accountability, right? Humans thrive with actually having something to do that they feel has a purpose in things, right?
Yes.
Absolutely. Okay,
so as well as that, Vernon, we asked those 3 questions, but I'm very nosy, and I'm sure everybody else is as well. We like to know what gives you joy outside of work.
What gives me joy outside of work? God, I've got loads of things. Right. I want to promote the notion of sauntering.
Sauntering.
To saunter. Right. So me and my wife. So during COVID, we got into going on long walks.
Okay.
Yeah.
You're only allowed out for walks, so we walk as far as possible. We got into it. Now, anybody can go on a hike. It's very goal-directed, and we'll walk up a hill and we'll see it. And then so no, there's a really interesting etymology of sauntering about being connected and in the moment and going on side quests. And there's this notion that it may be to do with old pilgrimages. This isn't about religion and going to the Holy Land, but it was about being out and connected with things. So nature. I'm a great believer that there's nothing that can't be solved,
right,
or you'll give up worrying about it if you walk far enough and talk about it.
Okay.
Oh.
Wow.
That's what I love doing. That's what we love doing.
I'm in. I love that.
Go for a long saunter. Don't go for a hike.
Saunter.
Go with side quests and go It's about adventuring. There's a notion of like playfulness in that, right? And about engagement in just going to, meet new people and go to different places, but do it on foot.
No, love it. It almost feels like letting go as well. So, as you said, you can solve everything.
You can, or stop worrying about it, one or the other.
There you go. Yeah.
Absolutely. Okay, that's great. That was great.
Thank you so much.
Thank you so much for your time. Absolute pleasure.
So how was that for you, Maureen?
Oh, he's so interesting. That was lovely. I mean, we're talking about things that we've said were like you said about the soft skills.
Yeah.
We've talked about it, that soft skills are essential, where, people have poo-pooed it, like to say you don't need soft skills.
Absolutely.
And he's just proven that is actually the heart of everything. I love that.
Yeah. As he said, people aren't clients, they are people.
Oh, gosh, yes. And I love that last part when he was talking about his 3 tips, when he talked about being trusted. But actually understanding what trusted is. It's not just giving people a pass so that you're liked, but actually being able to open up, hold people to account. And it's that relationship that people will trust that you can be open and honest, and vice versa.
Yeah, absolutely.
Really good. I love that. I'm going to have to go back and listen to more of that.
Indeed. So we have a level 5 Women in Leadership program. It's over 18 months, 1 workshop each month, and is rooted in a culture of trust and freedom, where managers step back and people are trusted to make decisions themselves. And if you have 3 million in turnover, it is based on the apprenticeship levy. But if you don't, it is 95% funded by government. So it's just £450 for all of 18 months.
Again, a no-brainer.
Yes, absolutely.
So please check us out. Tell us what else you would like to hear with us on the Happy Manifesto podcast. Please subscribe, find us on the website.
Put us in reviews.
Yeah, and find out more about what we do here.
Absolutely.
And in the meantime,
let us create joy at work.